Australia's vaccine strategy has been recalibrated, making AstraZeneca available to more Australians 50 and over from May. Joining me live now is the Health Minister, Greg Hunt. Minister, good to see you. Thanks for your time as always this morning. So you're now fast-tracking these AstraZeneca vaccines to those aged over 50. But when so much confidence has been shot, how do you rectify that?
Well, I think what we're seeing is over 300,000 vaccinations a week at the moment, bringing forward the over 50 vaccinations, fast-tracking them, beginning May the 3rd in state clinics and what are called Commonwealth vaccination clinics or GP respiratory clinics, and May the 17th for the broader general practice population in Australia. I think that's an important sign. Following the medical advice is what's kept us safe. If you think of yesterday, 880,000 cases worldwide, an almost unimaginable number, 0 in Australia. And so we have that comparison that the medical advice has kept us safe, and where we need to make changes, as we did, we've followed that medical advice, and that's what gives that confidence going forward. And when you see 1.8 million Australians vaccinated, those numbers climbing every day, I think that's a very important sign to Australia.
1.8 million, what is that in terms of a percentage of eligible Australians?
That's about 9% of the over 18s, and it continues every day. Every day those numbers are climbing, and you look at that outside world, 880,000 cases, 0 in Australia. Vaccinating now, where we've seen a 7-fold increase in numbers in 4.5 weeks since the GP rollout began, and we've had the increased supply from CSL, which is making sovereign vaccine manufacturing capability and delivering those vaccines here in Australia. And so now we're able to fast track for the over 50s and fast track for the under 50s in the 1A and 1B populations with access to the state and territory Pfizer clinics, and we thank them for stepping up and joining us. And so this is all about ensuring we do things as safely as possible, but as quickly as possible.
The problem, Minister, though, is trust, and I've just been talking to members of my own family, senior members that is. They have some issues with trust, and as you know, bookings have been cancelled when it comes to clinics and GPs, because a lot of people are worried about blood clots, and a lot of people believe that AstraZeneca is an inferior product to Pfizer, and now they're going to have to wait for that.
Well, with respect, when you talk about the effectiveness, the Lancet Journal, the World Health Organization, they've all put out papers talking about 100% effectiveness against serious illness, hospitalisation or loss of life. I think the figures that have come out from the UK were that the first dose Pfizer and the first dose AstraZeneca had respectively about an 85% protection for Pfizer and over 90% protection for AstraZeneca against the likely infection, low-level infection. Those numbers, of course, are coming through global trials. We've seen over 20 million people in the UK vaccinated with AstraZeneca. And where there's medical advice, we follow it. And it's very common around the world to have vaccines, as we have with flu, with one vaccine for an older age group, one vaccine for another younger age group. That's exactly what we have. And then during the course of the year, there's also an increase in the number of Pfizer vaccines. And so we want to encourage as many people as possible to be vaccinated to protect themselves as early as possible. But every vaccine also protects all other Australians. And so it's a really powerful motivator. And by following that medical advice, we've kept Australia as an island sanctuary, but we're following that same medical advice on the safety of vaccines.
There are roughly 318,000 aged and disability care workers included in Phase 1A of the vaccine rollout, but so far just 36,000, roughly 10%, have been immunised. How is that acceptable?
Well, we focused in terms of the incursion threats on the border protection and quarantine workers and the hospital workers in what are called the hot zones, or those that are COVID facing, and that's overwhelmingly complete. And then in terms of the vulnerable, of course, we've focused on the aged care residents, which is where, around the world, we've seen such terrible tragedy. And those programs are largely completed in terms of the border protection. The next part that is opened up as of yesterday is the capacity to ensure that those workers are now fast-tracked. The opening up of the state and territory Pfizer clinics for the under 50s, that gives a fast pathway. I had a round table with unions last night and was encouraging them and was really thankful for their cooperation and partnership. So we're progressively vaccinating as quickly as we can as many people in the country and working through the priority groups, starting with the biggest threats for incursion being those who are on the front line of the borders or in the hospitals, and now making sure that we've got this opportunity to fast track and expand out the workers, but having largely protected the elderly residents who are the most vulnerable. So that's the approach.
Just quickly, I've run out of time, unfortunately, Minister, but just a quick one on India. Why not close all flights? Why not stop all flights from India?
So 2 tasks. One is to bring Australians home, but 2 is to keep Australians in Australia safe. And so the medical advice was that we could and should reduce by 30% the number of people coming on Australian government-sponsored flights and 30% of total commercial flight numbers from India, so as we can still keep people coming home, but the hotel quarantine system could manage that load. If we need to reduce it more, just as we did last night, we won't hesitate. And that's the thing that's kept us safe. 880,000 cases worldwide in one day, 0 community cases in Australia in one day. These are the things which have allowed us to be safe. And so if we need to take stronger action, we will. But we always have to have that balance of the humanitarian task of bringing our people home whilst keeping our people safe in Australia.
Okay.